Ever wondered why sometimes going to the bathroom can be a real pain in the, well, you know where? In the world of health and wellness, we come across a variety of conditions, both common and uncommon. Today, we're shedding light on a condition that's often shrouded in discomfort and a bit of embarrassment: the anal fissure. An anal fissure is essentially a small tear in the thin, moist tissue lining the anus. This condition might sound intimidating, but it's more common than you think. It can cause a fair bit of discomfort, with symptoms that include a sharp stinging pain during bowel movements. You might even notice spots of blood in the toilet bowl, a telltale sign that something's not quite right. Sounds uncomfortable, right? So, what causes this painful condition? Let's dive deeper. As we move forward, remember that understanding our bodies is the first step towards better health. So let's get started. So, you're probably thinking, what causes an anal fissure? Well, let's dive right in. Anal fissures often develop due to excessive strain or pressure on the delicate skin of the anal canal. Think of this skin like a rubber band. It's flexible and can stretch quite a bit, but if you pull too hard or too often, it can snap. That's essentially what happens when an anal fissure forms. One of the most common causes of this strain is constipation. When stool becomes hard and difficult to pass, it can cause a person to strain during bowel movements, leading to the development of an anal fissure. So yes, something as seemingly simple as not getting enough fiber in your diet can lead to this rather uncomfortable condition. Next on the list is childbirth. Straining during labor can put a lot of pressure on the anal canal, leading to a fissure. It's a bit like trying to push a watermelon through a garden hose. The pressure and strain can cause damage, and that's when an anal fissure can occur. Inflammatory bowel disease is another culprit. Conditions such as Crohn's disease or ulcerative colitis can cause inflammation and ulcers in the anal canal, which can subsequently lead to fissures. It's like a road that's been worn down by heavy traffic and bad weather. Eventually it's going to crack and need repairs. Other causes can include anal intercourse, certain diseases like tuberculosis or syphilis, or even age. As we grow older, our skin loses elasticity. It's the same with the skin in the anal canal. So, there you have it. Anal fissures can be caused by a variety of factors, from dietary choices to childbirth, to underlying health conditions. They're a common but often overlooked condition that can cause significant discomfort. Well, now that we know what causes this unpleasant condition, let's move on to the different ways it can be treated. If you're dealing with an anal fissure, you're probably desperate for relief. So how do medical professionals handle this? Well, let's dive right in. The first line of defense against anal fissures is often topical creams or ointments. These treatments aim to relax the anal sphincter muscle, promoting healing and easing discomfort. They're applied directly to the affected area, and while they can be quite effective in many cases, they do come with a downside. Some people experience headaches or a drop in blood pressure. Now, if creams and ointments aren't doing the trick, doctors might turn to Botox. Yes, you heard me right. The same substance that some people use to smooth out wrinkles can also help with anal fissures. Botox injections can paralyze the sphincter muscle, reducing tension and allowing the fissure to heal. This is typically a more effective treatment, but it's also more invasive and can cause temporary incontinence in some cases. For severe or persistent anal fissures, surgery might be the best option. A procedure known as a lateral internal sphincterotomy can permanently reduce pressure on the anal canal, promoting healing and preventing future fissures. However, like any surgery, it comes with potential risks, including infection or incontinence. It's important to note that while these treatments can provide relief, they're not always a one-size-fits-all solution. Each person is unique, and what works for one might not work for another. That's why it's crucial to consult with a healthcare professional who can guide you towards the best course of treatment for you. Also, remember that these treatments are often used in conjunction with lifestyle changes like increasing fiber intake, staying hydrated, and avoiding straining during bowel movements. So, while medication or surgery can help, the role of a healthy lifestyle in managing anal fissures should not be underestimated. But what if you're looking for a more natural approach? Don't worry, we've got you covered. If you're not keen on medical interventions, there are natural remedies you can try. First up, warm baths. Also known as sitz baths, these can be a real game changer. The warm water works to relax the anal sphincter, which can help to ease discomfort and promote healing. Try soaking for about 15 to 20 minutes after bowel movements for maximum relief. Next, we have a high-fiber diet. Fiber is your best friend when dealing with an anal fissure. It softens stools and makes them easier to pass. This reduces strain on the anal canal and gives fissures a chance to heal. Foods rich in fiber include fruits, vegetables, whole grains, and legumes. So it might be time to swap out that white bread for whole grain and add an extra serving of veggies to your plate. Lastly, staying hydrated is key. Drinking plenty of fluids helps to soften stools, making them easier to pass. Aim for at least 8 glasses of water a day. And no, unfortunately, coffee and alcohol don't count. These remedies can help to alleviate symptoms and promote healing. However, it's important to note that they should be used in conjunction with, and not as a replacement for, professional medical advice. Remember, while these natural remedies can provide relief, it's crucial to seek medical advice if symptoms persist. So, there you have it, the causes and treatments for anal fissures. Not a topic for dinner conversation, but certainly important for your health. We've explored everything from what triggers these painful tears to how medical professionals approach treatment. We also touched on nature's own remedies, underlining how vital it is to seek professional advice for any health concerns. If you found this video helpful, please give it a thumbs up, leave a comment, and don't forget to subscribe to Restore Remedies for more health-related content. And remember, sharing is caring, so be sure to share this video with anyone you think might benefit. Thanks for watching.